This short video will show you what happens and what to expect when you're invited for NHS breast screening. If you live in Wales, you will receive a letter inviting you to go for breast screening. This invitation is for you if you are aged 50 up to 70 and are registered with your doctor as female. Taking part in screening is your choice. If you are a trans man and think you should have been invited for breast screening, contact your doctor. They will tell you how to get the tests you need. Your letter will tell you where and when to go. All you have to do is come along on the date and time shown. If you need to change your appointment, please let us know. We make every effort to be as flexible as possible, so whatever support you need, let us know before your appointment. If you need help to understand the information, we have other formats available, like BSL and Easy Read. Interpreter services are also available. We can offer a longer appointment if you need more time, or an accessible appointment. If you are worried about your screening, you can talk to a member of the team. We can offer you an appointment at the beginning or end of the clinic, or in some cases, a visit to the screening centre before your appointment. If you need a carer to come with you, or you care for someone who cannot make decisions, let us know. Our mobile units have lift access for wheelchair users and those with mobility issues. You may be wondering, why go for breast screening if you feel well and haven't noticed any changes? Breast screening looks for breast cancer before symptoms show. To do this, we take an X-ray of your breasts, called a mammogram. Finding breast cancer early gives you the best chance of successful treatment. Wear a separate top and trousers or skirt, as you will be asked to undress from the waist up. We may invite you to a breast screening centre or to a mobile unit. When you arrive for your appointment, we'll check your personal details and ask you if you've had a recent breast X-ray. You will be seen by a mammographer as soon as possible. Just so you know, they are all female. We will give you all the information you need about the screening so you can make an informed choice. You can read this while you wait. Your mammographer will check your personal details and ask if you have any questions. It's important to understand the benefits but also the risks of breast screening. If you are with a carer, we will ask if you would prefer the carer to stay in the X-ray room with you. They will need to stay behind a screen while the X-rays are taken. During the test, your breast will be placed on the mammogram machine. At least 4 pictures will be taken, 2 of each breast. A plastic plate will be lowered to flatten and firmly hold the breast in place. This will help to reduce radiation dose and get a clear picture. It may be uncomfortable, but won't last long, just a couple of seconds. You can ask to stop at any time. Your results will arrive within 3 weeks, and your doctor will also receive a copy. Most people will have no changes and will be invited again in 3 years. Get to know how your breasts look and feel. If you notice any changes, talk to your doctor as soon as possible, even if you have already been for breast screening. If a change in your breast is found, we will invite you for more tests at a screening centre. It's very important you attend. Most people who have further tests do not have breast cancer. If you want to talk about your results, you can contact us. Taking part in screening is something you can do to look after your health. Screening saves lives.